Which hip condition is often misdiagnosed for 5 or more years and takes up to 11 different clinicians to get the correct diagnosis. This study from Evans et al. 2022 reveals it and a way to remember the diagnostic clues. They did a mixed method study of 98 people with acetabular hip dysplasia, where patients have got a shallow, steeply orientated acetabulum that causes them hip joint instability and pain and limits their activity. So here's the mnemonic, alpha. So A is age of symptoms of onset. It starts when they're an adolescent or a young adult. Al is limp. That might be when you examine them or self-reported. P, they've got progressive hip pain. It's got a gradual onset with no known cause. They often have difficulties with deep hip flexion. H is the history of childhood and family hip anomalies. So they might have started when they were an infant or child, or they have a family history. A is articulation. So that's hip joint hypermobility and instability with clicking, clunking, or feeling like the hip's going to dislocate. And they often report as a child that they had difficulty sitting cross-legged and they W-sit instead. So those 5 signs are age, limp, pain, history, and articulation. So how does it help us? Well, if we recognise acetabular hip dysplasia early, we can refer them for X-ray and surgical opinion. These patients have got a much better chance of having a successful outcome.